Okay, we are recording. Woohoo! And we're going to go live. Okay, welcome. Thank you so much for joining us for Impact or live with Impact 100 and Welcome House. I'm Sarah Grace, as Barb mentioned, the president of Impact 100. And I just want to share with you a little bit about Impact 100, who we are, and what we do. First of all, I just want to say a big thank you to our sponsors, as one of our founding principles was that 100% of our membership dollars go back to our grant pool for transformational grants, which means we start every year with 0 operating funds. And so that means that our sponsors are a huge part of how we can do this amazing work. So we like to thank them every chance we get. So who is Impact 100? Impact 100 was established in 2001 by Wendy Steele right here in Cincinnati. And it's actually a global movement now. And the way it works is really simple. Women become members by donating $1,000 or $500. Then we pool those monies into grants of at least $100,000. And then we ask nonprofit partners around the community to submit grant applications in one of our 5 focus areas for transformational projects that we can fund that will move our community forward. So since our inception, we have granted back out over $5 million to, I believe, 47 transformational grants. Like I said, 100% of our membership dollars go to the grant pool and go right back out into the community, which I think is amazing. We're also 100% all volunteer working board. We have no paid staff except for a part-time outsourced administrator who we could not do it without. But other than that, it's 24 women working their tails off through committees, making all of this work happen, which is incredibly impressive. The other thing that I think is pretty amazing is that our members have a build your own adventure participation level. So you can write your check and feel good knowing that the other members are going to be great stewards of your money and your investment, or you can become president. I mean, it's the gamut, right? You can be as involved or uninvolved as you'd like. So coming up in September, the way we grant out award out our grants is that we do an annual award celebration every September where our finalists who have been vetted by our members come and present their project, and our members vote. And typically that's live, probably not so this year, but typically it's live, and we give the grants out, award the grants out just that night. So it's a pretty exciting time. And with us today are Justin and Morgan from our 2018 grant recipient Welcome House. And they're going to tell us a little bit about their project and how the pandemic has really shifted and shaped their work. So I'm going to end my slideshow and take it away, guys.
Thank you so much. We're really glad to be here. I am actually here on the RV right now. So when we get kind of done with this, I'll give everybody a virtual tour with my laptop. It's not a beautiful virtual tour, but we'll try to make it work. But yeah, we're so excited to be here. We launched the RV right around this time last year. So we've really been in operation for about a whole calendar year. I believe it was the end of July or early August when we did our official ribbon cutting. But we've really been out in the community with the RV for about a year now. So it's an exciting time for us to look back and kind of reflect on where we've been. And we're so thankful to Impact 100 because this just wouldn't have been possible without Impact. I remember when the process first started, we just kind of had a meeting where we were presented with the Impact idea and just kind of brainstormed of what we could dream to do with that amount of money. And, this has honestly been above and beyond what I thought we could do. So it's just really been a wonderful process. Just to share some numbers, again, we launched about right around now last year. And I was just looking at a report the other day. The first 6 months of 2019, we served 144 individuals in our street outreach program. And then this year, since we've had the RV for the whole first 6 months, we have served 467 individuals. So that's 323 more. And I really think that is in large part due to the RV. it really allows us to be out in the community more, to have more of a presence, so people know where to see us. They see a gigantic RV, so we are very easy to find now, and we're seeing a much bigger impact in the community. Our team has really focused on having the RV in Boone, Kenton, and Campbell County at least once a week, normally at local libraries where our homeless people congregate. But we've also had it at soup kitchens, different places like that. But we've really even expanded into the southern 5 counties that we serve, which are Grant, Pendleton, Carroll, Owen, and one more I can never remember. But we've really seen an increase in the amount of people we're serving in Grant County and Carroll County specifically. And these are people that we weren't serving at all before we had the RV. So we really have seen an increase in the impact here in the very northern part of northern Kentucky, but also in the southern parts, which has been a bit of a surprise to us.
And the last county that Justin couldn't remember is Gallatin, guys. Just wanted to let you know.
Appreciate that. So with the RV, it's out at those locations weekly. Morgan is always with the RV doing the medical component, but we also have our street outreach staff, and we also are now employing peer support staff, which are people who have a lived experience with homelessness to help people on that peer-to-peer basis. So we're serving a lot more people than we ever have before. The pandemic has certainly had a large impact. I don't know if anybody had seen, but we were operating a large shelter at the convention center in northern Kentucky when a lot of this started in March. And then we transitioned a lot of those folks into hotels. And we provided a lot of shelter to try to get people off the streets and try to flatten the curve as much as we can. But I'll let Morgan talk a little bit about some of the medical stuff that we're seeing and the work that she does.
Okay, so wow, this is an incredibly broad topic. Thank you, Justin. Uh, overall, oh gosh, where to even start? One of the big things that I've noticed was something that Linda talked about, was that there's a lot of chronic illnesses that are just extremely prevalent in the homeless population that are almost impossible to deal with if you are not living in a stable situation, such as diabetes. If you have an insulin that needs to be temperature controlled, then you can't store your insulin anywhere. It's in a backpack on your back, and it could get stolen. So anybody with with heart conditions who takes daily blood pressure pills, I have a lot of clients come up to me and say, hey, I've been out of blood pressure medicine for 3 weeks. Can you help me get more? Somebody stole my blood pressure pills and they won't give me any more. And then, and it just helps to have an advocate speak to doctors and who knows the medical field, because for most of you, most heart medications are not really something that people think to abuse. I don't know if I could, if I would say that they can or can't be abused, but people don't think to abuse heart medications. So if you explain to a provider and you are there, helping that person tell their provider that, the situation they're in, that they are homeless, that their medication was stolen, more than likely they'll be able to get it back. And people just don't understand or know how to advocate for themselves in the healthcare system. And so people just fall through the cracks. And a large part of what we do is taking stock of where people are in their healthcare journeys. So whether or not they have primary care providers, if they have specialists, if they have any chronic conditions that they are or aren't taken care of. And then I kind of meet them halfway and I show them what they need to do to take care of themselves in the future. And then kind of very, very slowly, I like to monitor what they're doing and then help them take, one step after the other. I recently had a guy who he's on blood pressure pills, and I'd been showing him how Welcome House can pay for his prescriptions at a specific pharmacy. And I'd been showing him how to take his medications. And then recently I showed him how to refill his prescriptions without my help, and he did it and he was successful. So hopefully, he won't need to come to me if he runs out of a medication. He'll know how to help himself. So that's a big part of what I'm trying to do here. Anything else that you want to talk about?
I think one of the that just brings up one of the big things that we focused on is education for our clients. So can you talk about some of the education classes you've been doing, Morgan?
Yeah, sure. One of the things that we were doing pre-pandemic was that we were offering different classes for our different clientele. So we have our street homeless clientele. We have our gardens clientele, which is actually kind of an apartment setup that we have for single parents who are experiencing homelessness. And we have payee clients, which is, I'm sure you guys know payee, money management kind of stuff. But for every group of clients, we have specialized education classes for topics that are relevant to them. For our street homeless clients, we have a lot of safe needle use. We have HIV and Hep C education. We have hygiene in the woods education. And then we have, like frostbite education and heat exhaustion education. For our gardens clients, we have home health safety education. So why it's important to clean your house. That's a big one. Not everyone is a big fan of that class, I have to say, though. We have, we have healthy eating with SNAP. That's a big one that we do for pretty much everyone because most of our clients have SNAP and EBT cards. So, we talk about making healthy choices with your SNAP, how to eat healthy on a budget. I'm drawing a blank. I know I'm missing a bunch of stuff. Whenever the spotlight's on, I blank. Sorry, guys.
But I think one of the other things we really want to highlight is some of the wonderful partnerships that we've made with the RV and that the RV have allowed us to do. Morgan's done a great job of building partnerships with the health department and local providers. We've also worked really closely with Caracal in Cincinnati, where we've been providing hepatitis testing and HIV testing in coordination with the RV. We've had the connectors to have people that don't have insurance, they can get signed up for insurance immediately with the RV. We were able to do a bunch of flu shots in the fall last year, which we'll look to do again. And then with COVID, Morgan's partnered with a nurse practitioner and with a lab, and we've been able to provide a lot of COVID testing. So the people that we had in shelters or hotels, or even people in our other programs. So that's been really beneficial because there's a lot of wonderful ways for people to get testing with the drive-throughs, but our clients don't have cars, and that becomes a lot more difficult. So Morgan's been able to provide that testing right where people are, which has been at no cost and has been really wonderful.
Sounds good. So are you going to give us a little tour?
Yeah, I would love to.
Okay.
I turned the air off because it was loud and now I'm sweating. All right. So here is the front of the RV. You can see that. So that's just where we drive. And then up here we've got storage. And this is where I've been sitting. It's really like the office environment. It's the kitchen table, desk. And then when clients come in, they'll typically sit right here on this couch across from the desk. And we'll meet with them and kind of get a quick assessment. Then we've got our kitchen and different resources and all that. Our fridge. We've got more storage back here. This is really where Morgan does all of our work. We've got our exam table here in the back. And we have this nice privacy partition. So if Morgan's back here seeing someone, they can be fully private. But we've got this wonderful setup. Morgan's got all of her medical supplies in these different cabinets. She's able to
pull out of that one. Sorry, guys.
So yeah, that's a quick tour of the RV.
Hey, Justin, could you show us the outside as well?
Oh yeah.
Good.
Just don't get dizzy from me walking around, sorry. So this is the outside of the RV.
It's great.
I can't tell if you can see that or not.
Yeah, we saw it.
And
Got a bold presence.
the really great part for us is with the grant, we were able to buy a brand new RV. So it was brand new. It has a very long warranty on it if we have any issues, but so far we've had no issues at all. And it also came with a brand new generator. So no matter where we are, the generator just runs off the normal gas tank, and we're able to have electricity, have internet wherever we go, and really be able to serve people very effectively. That also gives us heat and air conditioning in the RV so people can come in and cool off or warm up when the weather's bad. Yeah, I'm out of breath now. Morgan, you can talk for a little bit.
So we do have one question from Molly. Do they carry and dispense drugs from the RV? Is that what you do?
So we carry and will dispense on occasion over-the-counter products. As a nurse, I have to have a practitioner giving me orders to give out that sort of thing. So for my the nurse practitioner who's kindly volunteered to medically direct me, she has a few standing orders that I'm allowed to like give out Tylenol and ibuprofen, hydrocortisone, Tums, stuff like that. But there's no sort of controlled medications on there now.
And let me ask you that the van seems so long. Do you need special licensing for that, or a special, special license, I guess they call that, right?
You don't, but maybe we should, because Morgan's backed into a couple things now. So
I've only backed into one. The other was Robin.
But no, you don't need any. You don't need any special license.
It looks mighty long to me. It looks
pretty
long.
It's 33 feet, I think, so it is very long. It's difficult to drive for sure.
Speaking from experience, there's definitely a learning curve. I learned to drive on a Volkswagen Bug, and I still don't think I've quite adapted.
Yeah, it's not easy. And one of the other questions, which was a great one, is about how it's increased our way to serve people with dignity. And it's increased that. I mean, I can't even express how much it's increased that. Our clients are able to come into this just wonderful environment that, again, has AC and heat. We're able to offer them food and drink, and they can just kind of relax while they're with us. Instead of us serving them on a sidewalk or curb or something like that, it's a really nice environment where people can sit down and take their time instead of these rushed environments that are outside. So it really allows Morgan and our street outreach team to really dive more in with people, and it allows them just to feel a lot more comfortable. Because it's just when we're serving people outside, which we still do, it's just a totally different environment. You have cars and stuff going by, or in the rain, and this just allows such a comfortable environment. It's wonderful.
And especially since, on our busier days when we have lines of people coming up, like at the Covington Library, there may be a lot of people who just want a snack or a drink and just want to say hey and check in with us. But if somebody really needs to talk to us and sit down and tell us what's going on with their life, it's very nice to have a private area that's away from that, so they don't feel like there's a bunch of people standing in line waiting for them to get done. There's no rush, and that's just really great.
Yeah. And Claire just asked another wonderful question. Thank you, Claire. It was a big plan of ours to have nursing students and other doctors riding along in the RV, and that is something we've done a lot of. Morgan, you can talk about the nursing side of it, because I don't remember all of it, but we've partnered a lot with St. Elizabeth, and we're still working through some of that. But it was in the plans to have us a part of the residency training with St. Elizabeth physicians. COVID has kind of stopped all of that, but that's definitely in the works. And we've also built a partnership with the new medical school at NKU. That's through UK. So we will be a part of their training through the medical school as well, which that's very exciting for us. It's kind of the same thing where that was in the works, and then COVID has thrown a bit of a wrench in that. And they're only in their first year of that medical school, but we'll be a part of it as they go through medical school. So when they get in like their later years, 4th or 5th year, they'll really be able to do a lot with us on the RV, which is exciting. And also the volunteer nurse practitioner that Morgan mentioned earlier is out with us in the RV some. So yeah, we've really expanded that a lot, which has been exciting. But I know Morgan, I believe we've had nursing students from Xavier. I don't.
Yes, we this obviously this semester we haven't had any, but last semester we had Xavier nursing students coming with us twice a month. They would meet us at the Covington Library or the Campbell Library, and that was really great. It actually got to the point where they did their final class projects to be one of the education seminars that we hold in the libraries for our street homeless residents or street homeless clients. And that was really awesome just because I feel like something that a lot of people overlook is community health for providers. Whether you're a doctor or a nurse, you overlook that one facet of medicine. And it's really great to get the next group of providers right as they're coming out of school, just to understand how important that is and to be looking at all their clients through that lens.
You guys are just killing it with the questions today. I love it. So Molly asked, how would a homeless person find out that the RV will be at the local library? That's a great question. We have, and I wish I had one, we have really big posters that we hang up with information at the library and then other typical locations that our clients will be at. But it's also the big thing that the RV has granted us is to have consistency. So we're at the Covington Library every Monday morning from 9 to noon. So that has been that way for a year. So people have just come to expect, hey, they're going to be at this place on Monday. We're going to be in Boone County every Tuesday afternoon. So we've been really consistent with that, which has allowed people just to know where we're going to be and when we're going to be there. So we have those big flyers. We've created a lot of different little flyers that we hand out. Here's one right here, actually. So we've got this great little handheld flyer. It just lets people know where the mobile health clinic's going to be at. And they're just these nice little cards that we can just pass out to people wherever we see them, or that other community partners that might need help will know where we are.
Mm-hmm.
So then Sarah Grace asked about, has COVID shifted our protocols? Yes. COVID shifted a lot of our protocols. We obviously have to be a lot safer when approaching people, and our staff have to be masked and wearing gloves and a lot of that stuff. It's also stopped us a lot from trying to get people to congregate in groups. Prior to this, when we would have the RV at libraries, we would have tables set up outside and have lots of food and have coffee. And then we would have lots of clients just kind of hang around, eating food, drinking coffee, and we'd all chat. We've stopped doing that because obviously we want to encourage social distancing. So that's changed a lot for us. It hasn't changed a lot in us being able to help people effectively, I think. We're still able to do a lot of the work. It's just kind of us being more creative in how we approach people. It's also when everything was shut down, and a lot of things are still shut down, it's a bit harder for us to locate people. At the Covington Library, for instance, there might have been 100 people that were homeless at the library on a Monday that we would see. Now they're only allowed to really be in the library like an hour at a time. So people are just kind of more spread out. They're not all concentrating at the library. They're just at different locations. So we've had to just be out and about a little bit more. Do you have anything to add about the COVID procedures, Morgan?
So for COVID, I mean, really, I think the biggest thing that I've noticed is that because we're not finding people as much, it is a little bit easier to enforce things like social distancing. Our tables, like Justin said, we don't have anything that's not packaged, and we'll have it like spaced out like 3 on top of the table so that if somebody wants to grab one, they can. But once they grab something, it's theirs. They're not allowed to put it back. Everything, like if we take somebody into the RV, I mean, it was already being sanitized, but now it gets the full kit and caboodle, like it's Lysol, bleach, everything. It's very labor intensive. And let's see, what's another thing that we're doing?
Well,
It's
we focused again on a lot of education for our clients too. So we're really passing out a lot of hand sanitizer,
yeah.
encouraging mask wearing. Morgan yells at everybody for a mask all day, every day, which is great. Um, and we also were able to provide some hand washing stations to some of the homeless camps, which is wonderful. So really trying to encourage more hygiene for people and just educate them about the impact that could have. But we've also really beefed up a lot of our partnership with St. Elizabeth through this. So we're helping them a lot when they have people in the hospital that are COVID positive and need to quarantine and have nowhere to go. So we've been able to place a lot of people into hotel rooms and get them out of taking up hospital beds when they don't need to be in the hospital. So that's been an exciting thing for us. All right, and then Claire asked, is the outreach van changed the visibility of Welcome House's work? Yes, it very much has. I think everywhere we go now, people say to me like, oh yeah, the RV, especially because we park it right on 12th Street in Covington at our office. So a ton of people drive by the RV and see it. And then out in the community, it's so visible with the nice wrap that we were able to get on the outside of it. And I think it's increased our visibility a lot. It's just a real, before people would see us pull up in a van and they would think, who are those weird people in a van? And now we pull up in this really professional looking RV with this beautiful wrap, and it really gives us legitimacy from the client's perspective and the community perspective. Morgan could tell stories, but a lot of times we're out at libraries or different locations and people from the community will just come up and be like, hey, tell me more about what this is and what you're doing. And I know a few times we've had different nurses that have approached Morgan, and you know, people just see it and they love it and think it's such a cool idea. As far as it being a factor in the Jeff Bezos grant, I don't think that it necessarily was a factor in the Jeff Bezos grant, but I'll say it was, sure. Then Linda asked, have you been able to measure the number of contacts that you move into temporary or permanent housing? That's something we're looking at, measuring more and more every day, Linda. That's a great question. Our main goal with our outreach program is to connect people that we're seeing into the other Welcome House services. So to get them connected and into our shelter or into our case management programs, that way they get more assistance and more long-term assistance. And those programs have really great success rates for getting people into housing. I believe last year, our shelter had more than 75% of the people exit into positive housing solutions. So we really feel like when we're seeing people in the RV, as long as we can get them wrapped into other Welcome House programs, they're going to have a high success rate of getting into housing.
Wow, so impressive. Anyone else have any other questions?
I was wondering if Claire or anybody else who's on the focus area committee wanted to talk about anything from the Impact 100 experience.
Sure, I'd love to. So my name is Claire O'Brien, and I was the focus area chair in 2018 when I first met Justin and Danny and the whole team at Welcome House. And it was just an amazing experience. I learned so much from them, and I think the entire committee did. And Justin was so patient, and he explained to us all the impacts that homelessness can have, particularly on health, physical safety, protection from the elements, getting adequate sleep and proper nutrition. But then he also explained things that many of us hadn't thought about, which was if you don't have a home, you can't apply for a job. It's very hard to get the benefits that you might be due. And also if you have children, if you're a young family and you're moving from relative to friends, couches, it's really hard on the children because they're constantly changing schools. So it was really an education, both intellectually as well as emotionally, about what can lead to homelessness. And they really helped share some of the stories of the people that were experiencing homelessness. And I think that touched a lot of our committee members. And then they showed us what they were doing at the present time to do their outreach. And literally they were strapping on these huge backpacks and going under bridges to take care of wounds. They were dressing I believe, a veteran's foot in the White Castle parking lot. And Justin showed us the vans that they were using, which were regular transport vans that were really impossible to sanitize. They weren't configured to have people, and they really didn't offer any privacy. And so when they gave us this proposal for a dedicated medical RV van, all of us were just so excited at the potential that this had. And so it's just really heartwarming to see that everything that they dreamed about has actually come to fruition. So congratulations. I mean, I think everybody in the nonprofit sector, has a certain kindness, but the entire team at Welcome House they really exuded compassion and nurturing in a way that, is just exemplary. And I think we all owe them a debt of gratitude for what they do in our community.
Wow, thank you. I'm glad this is being recorded. I think that might be the nicest thing anybody's ever said about me. No, and this is just, I mean, honestly, it was a dream that I didn't think could become real. And it's just been, I mean, the best thing that I've ever been a part of here. It's hard to believe that this is really what we're doing, but we're seeing such an impact in our community. And I know that this RV has already saved lives, and it'll continue to save lives. The work Morgan and the team do every day is so impactful out there. It's a really great thing to be a part of that wouldn't have been possible without Impact 100.
Great. So, and Justin, if there's anything we could share with our community as far as your wish list or, those,
Yeah, that's a great question. Our wish list is always updated on our website. So if people head to our website, welcomehouseky.org, you'll see a wish list that we keep very updated. So that's probably the best place to go. Really, some of the big things we're seeing now are the same things everyone is seeing. We have a big need for, we're getting a lot of donations of hand sanitizer, but they're really large bottles. So we're trying to figure out a good way to get them into smaller bottles to be able to distribute to our clients. So that's a big need. And, anything that we can hygiene wise to just keep our people safe and encourage hand washing and all of that. But we always have a big need for tents and sleeping bags. And we had a wonderful donation 2 years ago of, I think it was around 1,000 sleeping bags. And we are almost completely out of that. So we've given away about 1,000 sleeping bags in 2 years, which is crazy. But it's really concerning that we're almost out of those, because those are such a life-saving thing for our people that are outside. And COVID has really impacted the homeless shelters. Some of the homeless shelters had to shut down completely. So it forced more of our clients that were in shelters out onto streets. And some of those shelters have reopened now, but they're at limited capacity. So really, we have way more people that are forced to sleep outside right now because of how this is impacting shelters.
And this sounds very not important after Justin says something like that, but I would kill for some Lysol wipes.
I think we all would, actually.
Yeah, so if one of you just has like 1,000 containers of Lysol wipes, so that would be great.
So I know this is like a really minutia question, but what about handmade alcohol wipes, like with paper towels and like alcohol? Would that be acceptable, or would that be you need them to be like manufactured?
I mean, I'd have to look at that, just because like what I really like was the Clorox wipes specifically, just because of how well they supposedly work on the virus. They are saying that, that's like the most effective is after 2 minutes, Clorox. But I mean, I could probably look into making my own. It's probably a pretty good idea.
Or, I mean, we could make, I was saying we stocked up on alcohol and I have paper towels, so.
Little alcohol Clorox blend.
Right.
Yeah.
And just put them in baggies, maybe? Is that what you think? Is that what you're thinking?
Maybe look, there are like the tall Tupperware Tupperware things that kind of feel like the Clorox.
I will accept anything that anyone MacGyvers for me.
Okay.
Yeah, we're not picky. I do want to. Linda asked if we could speak about the Bezos grant, which I can do really quickly. We did get a Day One Foundation grant from Jeff Bezos' foundation. which was great. And we're very, very thankful. It was, I think, $1.25 million. I'm bad with numbers, so it might have been 1.5. But that was a really great grant. It is, which this is another reason why Impact is so great. It is a bit of a restrictive grant. It can only be used for very specific things, and it can only be used for families with children. And the couple things that it can be used for are stuff like diversion. So instead of families having to come into our shelter, maybe immediately helping them get into an apartment or into a hotel instead of shelter, or it can help support the sheltering of women and children. So we really focused a lot of that on helping families not have to enter the shelter system and hopefully help them get into like a hotel or a safe environment. Because there's a lot of studies out there about once somebody enters into the real homeless system, then it costs so much money to get them out of that. So if we can kind of divert and keep them out of that system, that's really beneficial for us. But that money is really restrictive in what we're allowed to use it for, which most grants are. I mean, Impact is one of those things that is so rare, I think, and how we can use the grant money.
Any other questions or comments? Well, I just want to say thank you so much to Morgan and Justin for sharing the amazing work that you do. And we are so happy to be able to sort of share on a much broader basis. So for people to understand, you know, what the need is and how important it is to continue to fund you. I also want to thank everyone for being an Impact 100 member. And if you are not a member and are interested in learning more, you can go to impact100.org. And just, you know, as Sarah Grace had mentioned, you can join up at the $500 level or the $1,000 level. You can pay, there's a variety of options. You could pay monthly, you could pay quarterly, or you could pay just at one shot. All we ask is that all money needs to be in by December 31st, so we know exactly how much grant money we have. Well, there you go. Thank you so much, Sarah Grace. So that sort of shows you exactly, you know. And again, you know, we are excited because tomorrow we are going to announce the finalists. And Justin, I'm sure you can maybe remember that.
Very much so.
I know, and it's a really exciting time, and we really look forward to sharing that. So that is tomorrow at noon. And we also invite everyone to take a look at our events that we have coming up. We have not only our Live with Impact 100, which is weekly, but we also have our Step Up series, which is really a great way to get outside, to experience the outdoors, to learn about an area in our tri-state, as well as hear from a grant recipient. And we also are really excited about our DEI group. We have equity champion meetings where, you know, we talk about racial equity, and we have various discussion groups. So that is something that we have grown a lot this year and are really excited about. But for all that information, just go to Impact 100 and take a look. And we hope you take advantage of some of those offerings. So thank you again. I think this has been great. Justin and Morgan, thank you for sharing your experiences. This is your second time with us, and we couldn't be more happy to be able to highlight you.
Thank you. We're always happy to do anything for Impact.
Thank you so much.
Thanks for having us.
Well, you're so welcome.
Have a great day, everyone.
Yes, everyone have a great day and a safe one too.
Absolutely.